I think sometimes when we don't understand something, we start to really seek out those answers. And we ask questions, or if we're worried about it or ashamed about it, we just ruminate on it, meaning we let it loop and loop and loop and loop. Or we go to Dr. Google and we look it up and try to figure out, do I need to be worried about this, or do I not need to be worried about this? And one of those things that apparently a lot of people seek out answers for is around PTSD. So I would like to talk with you about that today, if that's okay, to try to alleviate any concerns you might have, break it down into its simplest form and not in psychobabble, hopefully. So who am I to do that? I'm Kim Long. I'm with Docha Psychological Services, and I do work with clients who have a myriad of issues, one of which is dealing with trauma and stressor-related disorders, one of which is PTSD. So let's talk about trauma real quick, because there is a misunderstanding, I think, around the word trauma. And I won't go too deep into this because I believe we've done other videos about it. But trauma can be understood in its simplest form as anything that really overwhelms your system in the moment that it happens. Now, what does that mean? It means that in the situation, you end up feeling really, really helpless. Like you don't have the answers to solve it, that even if you had the answers, you wouldn't be able to use them. There's a sense of maybe being trapped. So when you think about fight or flight, those are two responses that if you're able to enact them in the situation, you probably, hopefully, won't feel the full effect that trauma can cause because you are able to act. However, when you get into freeze and feign, where you fake being dead or you completely shut down like a deer in the headlights, those, in my opinion, and again, this video just represents my opinion based on my experiences working with clients, based on research. It does not represent the view of the college. Yes, I have to do this disclaimer. And it does not constitute a therapeutic relationship. It's just for educational purposes. Okay, back to the story. So basically, in my experience, it's when clients experience freeze or feign, where they aren't able to act, deer in the headlights, pretending to be dead. Basically, their system completely shuts down. That typically seems to turn into, more often than not, a diagnosable trauma and stressor-related disorder. And it's because you basically, in my opinion, you can't trust yourself anymore to be able to resolve threatening situations. So let me summarize that because that was longer than expected. Basically, trauma is when you shut down and you can't cope with whatever's happening. And sometimes that trauma can feel stuck, like it's long lasting. So this also means, though, that something that's traumatizing to one person won't necessarily be traumatizing to somebody else. It depends on how resourced they feel in that moment. So there's no right or wrong. There's no, hey, that's not traumatizing because whatever. You aren't that person. You don't know. So, however, I do also believe that the word trauma, as many of the diagnoses in the DSM, are overused as slang to mean something else. So in my clinical practice, when I'm talking about trauma, I'm talking about something that put this person into a state of overwhelm where they couldn't cope at all. And now they're left with the dregs of that they're trying to work through. So now what makes that clinical? Well, one of the first things you look at, excuse my dog's barking in the background, it's probably a squirrel. Just saying. I'm going to finish, okay? Good job. All right. They said hi. So what makes it clinical is one of the first things we look at is it interfering with social, occupational, or other types of functioning. So can the person still go to work? Can they still engage in relationships? Is there disruption to any of those situations? If there is, it can be considered clinical, especially depending on the degree. So, in the DSM, which is our diagnostic Bible, there is a category called trauma and stressor-related disorders. In that category falls PTSD. So just because you experience a trauma, or a traumatic event, it does not automatically mean that you will struggle with PTSD. It depends on whether or not the event was actually traumatizing, which for some people it could appear on the outside, as I said, that it should be traumatizing, but it's not always. So keep that in mind. It depends on the person. But also there's specific criteria that has to be met for it to be PTSD. So I just want to talk about some of the other things that are in the trauma and stressor related disorder category. So there's something called adjustment disorders. And an adjustment disorder is basically where an event happens, your system's overwhelmed, and you kind of get stuck in it. And you are unable to cope with it in a manner that an outside observer would say is normal, right? Or appropriate. And because of that, you are noticing interference in those areas that I talked about, but also you just can't seem to move through it. So you're having a hard time adjusting, which is why they call it an adjustment disorder. Then another diagnosis that is in this category is called acute stress disorder. And you can think of this as pre-PTSD because it meets a lot of the criteria that is the same as PTSD. However, it is for when you're experiencing those symptoms up to a month after the event. If those symptoms stop at about a month, you do not receive the diagnosis of PTSD. You would receive the diagnosis of acute stress disorder. Now, if those symptoms persist past a month, then you're looking at a diagnosis of PTSD. So what goes into PTSD? Criterion A, and again, I believe I've done a video about this, but it doesn't hurt to go over it. Criterion A is the most important thing, because if you can't meet criterion A, you don't have PTSD. Criterion A basically says there has to be a physical threat. Here's where the field starts to argue a bit, and I won't get into all the politics behind it. But some of us in the field recognize that there are things that create the trauma response that could be perceived as physical threats, but don't necessarily exclusively meet that criterion of physical. So again, still a squirrel. Yeah, good job, Coop. Okay, so he has something to say about this. But anyway, so it has to be a physical threat. Now, here's the other catch. It doesn't have to directly happen to you. It could be something you've witnessed, and it could be something that you've been exposed to repeatedly. So for example, I'm sorry to say it, but COVID, when we were hearing all the time about the life threat, right? That could potentially set the stage for PTSD because it meets the criteria for a physical threat, and it's something that you are exposed to chronically. Now, I'm going to get into another definition in a moment or two here, which might challenge this. But anyway, so that has to be met. If that's not met, you don't move on to any of the other criteria in PTSD. But then we look at intrusive symptoms. These are things like flashbacks. These are things that happen just out of the blue, and the person becomes completely discombobulated and doesn't cope well, may react with anger, may react with complete shutdown. It depends on the person and the way that their symptoms present. There's also avoidance behaviors. You avoid memories, you avoid locations, you avoid people, you avoid anything that could potentially make you feel like crap, specifically around the event that caused the PTSD or that the symptoms are tied to, related to. So PTSD is usually thought of now as a one-time event that led to the other stuff, but I'll get into why. Okay. We also look at negative cognition or negative mood, meaning that you're experiencing memory challenges, decision-making issues, problems regulating your emotions. You might be hypervigilant, and this gets also into arousal and reactivity symptoms, but you have an inability to experience positive emotions, or you might be experiencing a lot of guilt, shame, and then the reactivity and arousal again is around hyperactivity or hypervigilance rather. Lots of sleep. You might just need sleep all the time. So all of that kind of gets schmozzled together and you end up with a diagnosis potentially of PTSD. Now, where the problem comes in is that PTSD also shares a lot of similarities or overlap of symptoms between anxiety and depression. So that's where you go to a trained clinician to figure out, okay, is it anxiety? Is it depression? Is it PTSD? Is it both? Lots of fun. It's like a big old puzzle, and I'm sure you just love it. Not so much. Now, I'd like to take another couple moments, and I know this video is getting long, but I want to take another couple moments to talk about something called complex PTSD. You will meet all of the criteria that you would for PTSD. However, what is typically thought of as complex PTSD is where you have had a series of events, like a series of isolated traumatizing events that would meet the criteria for PTSD, or you've been exposed for a really long period of time or an extended period of time to the same stressor over and over and over and over and over. And then it sets the stage for these symptoms to almost become really ingrained, and they get layered on top of each other, these events. And so it creates a complex case of PTSD. It's more than one event. It's or a one minimal snapshot in time. Not to diminish PTSD, that's not what I mean. But it's just a lot. So you'll see more extreme symptoms typically showing up, and sometimes you'll see more of a hesitation to give up certain ways of coping, like the hypervigilance, for example, because that's how they've learned to feel safe over a long period of time. It's now become habitual, and it's frightening to give that up. Okay, so what are you supposed to get from all of this? First of all, try to identify whether or not it is actually a trauma. Secondly, you want to look at, is it interfering with certain really important parts of my life? Third, was there a physical threat, however you perceive that, to my survival or the survival of people I care about? And then do I meet all of these other symptoms about intrusion, avoidance behaviors, negative cognition and mood, and arousal and reactivity? If all of those are met, you might meet the criteria for PTSD. Now, I say might because I'm hesitant for anybody to use this to diagnose themselves. I would encourage you to find a provider in your area who is skilled in this or is learning about this, and have them help you through it if you're trying to figure it out, because it's a lot, and it brings with it a lot of preconceived notions about what it means for your life. Okay, and I don't want you to worry about that stuff. Too late. Sorry, but seriously, it's like any illness. You can have a certain degree of recovery. So there's always hope. And as always, if you have any questions at all, please just let us know and we'll do our best to answer them. And in the meantime, just hang in there and we'll talk soon. Okay? Bye for now.